Hello everyone. On behalf of the Continence Foundation of Australia, I'd like to welcome you to this evening's webinar. Tonight's topic is an important one. It's about living fearlessly when you have to deal with the issue of incontinence. And you can live fearlessly by knowing which continence products you need. So these are the continence products you'll wish you knew about a lot sooner. I would like to first acknowledge and pay my respect to the traditional custodians of the land on which we meet today. I would also like to pay my respects to the elders, past, present and emerging of all of Australia's Indigenous peoples. Now tonight we're going to be looking at the products that you can use. We'll be looking at the costs and funding associated with them, laundering and disposal of those products, and the supply sources for those various products. Now, it gives me great pleasure to introduce you to our presenters, and I hope you'll excuse me if I read off my sheet tonight. So on the far left of the panel is Janie Thompson. Janie is the Clinical Services Manager at the Continence Foundation. She previously worked as a nurse continence specialist and continence service manager at Alfred Health, and she has over 20 years' experience working as a nurse continence specialist. She's the immediate past president of the Continence Nurses Society of Australia in 2013 to 2018 and has been the treasurer of the Continence Nurses Society of Australia, both the Victorian and Tasmanian branches. It's also important to note that Janie heads up our National Continence Helpline. So she brings a lot of not just clinical experience, but listening to the concerns of consumers out there as they grapple with the management issues of their incontinence. So a big welcome to you, Janie, and thanks again for giving us your time.
Thank you, Bron.
Now, trapped between Janie and I on the panel this evening, we have Greg Ryan. Greg is a member of the Continence Foundation of Australia's Consumer Advisory Committee, and he's an advocate for the Bins for Blokes campaign. We'll talk more about that a little bit later. He's a 56-year-old Melburnian who was born with a rare congenital condition called imperforate anus, also known as anal rectal malformation. So in layman's terms, he was born with no anal opening and required reconstructive surgery to create an anal opening as a child by connecting his rectum to his anus, and also has no functioning sphincter muscles. This has resulted in Greg living a life of fecal incontinence, which has impacted greatly on his physical and his emotional health. Greg is now a very active advocate for those living with fecal incontinence and has written 2 internationally recognised books, as well as being a keynote speaker at colorectal conferences in Australia, the United States of America and in Europe. And he's passionate about raising awareness and understanding of fecal incontinence. The really wonderful part about having Greg as part of our panel tonight is that he's going to provide us with his lived experience of long-term management of an incontinence issue and how he goes about using those products. So thank you so much for your time, Greg, and I know that your input will be invaluable this evening.
Pleasure to be here, Bronwyn.
That's lovely. Now, don't forget, this is actually a live webinar. We're coming out to you live from the Melbourne studios this evening. So if you have questions, please don't hesitate to use the question tab on your screens. Type in your question. Both of our presenters are happy to be interrupted so that we can get to your question at the right time, and our panel will do their very best to address that. So don't forget, send those questions in. And now it's my great pleasure to hand over to you, Janie. I get to pass the baton, so to speak.
Thanks, Bron. So when we think about continence products, it's often important to have a continence assessment through a nurse continence specialist, because we or us or they can help you choose the right product for you, teach you how to use and care for the product, and also look at what financial assistance is available. Because social continence, or basically making sure that any incontinence is not obvious to the community, is a really important step when it comes to managing incontinence. But there is a lot of products around on the market and it can be very confusing. And I know, for example, today I was working on the National Continence Helpline and I did receive a lot of calls from people wanting guidance on what product they should use either for themselves or someone they were caring for. for, because there is so many options out there, and even knowing what's out there beyond what they can find in the supermarket can also be a challenge, because what you don't know, you don't know. So it's sort of helping guide people. I think also when it comes to social continence, if you can contain it and it's not obvious to everyone, you can get out and actually get that treated and have a more active life. So it's often a first step in actually doing something about your continence problem, is actually making sure no one knows about it and you've got a good product to keep it well contained. So when we think about continence products, I suppose the most commonly used continence products are pads and pants, and they come in a very large array of sizes and shapes, lots of different absorbencies or how much urine they can hold. They can also be used for fecal or bowel incontinence, and they can be disposable or reusable. So if we particularly have a look at disposable pads, but before I move on to that, we often look at a combination of pads as well. So there's often not just one product to use all the time. Often people will have a product for day and for night, a product to use at home, or a product to use when they're out. So they often use an array of products, because there's often not one perfect product to suit every occasion. So when it comes to disposable or single-use continence pants and pads, they can be very absorbent. So they can go from a very light loss to about 50 mils to over 4 litres, as I was looking at some continence products today. So it's amazing the absorbency that varies. They're usually used once only and then thrown out. For example, I can show you like a male-based product, which is a liner, a light product for a male, and it's actually shaped to suit a male body shape. So it doesn't have, this is for a urine problem, it doesn't have the tail end that often isn't required for a male.
Sorry, Janie, can I just ask, that looks an incredibly thin product.
Yes.
So is that for someone who's got light urinary continence?
Yes. So this is a male liner. Obviously, there is higher absorbencies in this, but just to give you an idea of even a liner that would be a similar thickness for a female, or someone who wants a longer pad for, say, for fecal incontinence, a liner is quite a thin pad, but it still has quite a degree of absorbency in there, despite how thin it is.
Thanks, Janie.
Then you would also come to a pad that actually has a sticky tab on the back that you would put in generally a normal pair of underwear, and the absorbency increases now to maybe 100 or 200 mils or so, but can wear in normal underwear and can be still quite discreet as well. You might then find, for example, there are a need to even go to a much larger pad. So a pad like this can hold, say, 1 litre of urine, and it has special leak guards. Some of them also have wetness indicators where you can tell how much urine has been soaked into the pad. They're often worn generally with a pair of light net pants to help them be held in place, because the firmer the fit or the snugger the fit of a continence pad, the better it works, because if it's nice and high and tight against the body, it absorbs quickly and you reduce the risk of leakage.
Janie, I once heard a continence nurse talk about channeling that pad so that you get a better fit. Can you just explain what that means?
Yes. So often these are packed very tight or vacuum packed. So when you get them, they're actually very squashed down. So it's often important to actually fold the pad in half and give it a little tug, just to help get the leaf guards to come up. So the little side guards here are an extra advantage or an extra design feature to help stop leakage out the side. So it is important that you do sort of fold the pad in half, give it a little tug just to get that spring into it and get those features up and working. So you can also see that it's already curling up a lot better just by doing a channeling to actually get the right spot and the right fit. They're generally made of pulp plus superabsorbent polymers, so special little grains that if you really push hard on the pad, you can feel a slight grittiness. And it's the superabsorbent polymers that do the bulk of the work, because they can hold quite a lot of urine. So they're the main working force within a pad. Sorry, that's an unusual way. We also have pull-up pads. I know this is a very small-looking pull-up pad, but they're very popular, I suppose, when it comes to pull-ups, and they can be particularly good for people who are still walking, and you can just pull up the pad and wear it like a normal pair of underwear. It often sits quite easy, so it can be, especially for, say, someone who's got some memory problems and might find wearing a pad unusual. You might be able to find something like this, and a person might not be able to realise they're wearing it, or someone has problems towards adjusting a pad. So when it comes to like a net pants and any insert pad, you have to do a bit of adjustment. So for a pull-up, you're just pulling it up into place and hopefully getting to the right position. And again, they come in a lot of sizes and absorbencies. So you could go from a pull-up that might be a 500 ml pull-up to a 2.5 litre pull-up. So they do come in an incredible range of absorbencies as well. And then finally, we have like an all-in-one, which is a bit like a diaper-style pad, which has tabs at the front, which can open, which this one's been closed, so I hope I can open them because they might not open on me. So if you can imagine, sorry, I'll just put my hands through it to sort of show where the legs goes. But this can be, this is the most absorbent type of pad that we have on the market. And again, you're probably going from a litre to about 4 litres in absorbency. And I must say, when I'm talking about absorbency, I'm talking about working capacity. So that's like a maximum capacity, the full amount that it can actually hold. They have tabs that should open and close. These ones have obviously been closed for too long and I can't open them up. Oh, here we go. And they are adjustable. So they're often good for people who maybe are bedbound, or it's difficult for them to stand and move their feet. So you can slip it through their legs, tighten the bottom tabs first, angling them upwards, and then tightening the top pads to get a good fit. So, yeah, these are the most absorbent type of product you'll actually see around. But generally, some of these more absorbent products you won't see in the chemist or the supermarket, and that's when you need to go to special supplies to be aware of those. So I was
ask Greg, how do you, now I know that we're talking about fecal pads for you, yes, fecal incontinence, but how do you go about sourcing your pads? Is it difficult? Is it trial and error?
It's, for a male especially, you have to get used to sort of like going to the chemist or the supermarket and ask for a box of female panty liners, in my experience, and then you have to work out which one fits and which one absorbs, and it's a trial and error is definitely. And for someone who's got fecal incontinence, you can really have irritation with skincare as well. So you have to really find the right one that suits you. And the other thing too that guys have to take into account is a lot of guys wear boxers, and rather than just the briefs.
Yes.
So to find the right, especially for boxers, you have to find the one that to be able to stick to the boxes and they aren't as tied in.
Yeah.
So it's all a personal fit, but without them, I wouldn't be able to function without having an incontinence pad on.
Yes.
Because mentally you'd be sort of like worrying, am I soiling or whatever. So it's not just the physical helps you, but it's just the emotional side, that knowing that you are safe.
Yes, yeah, that's really important. Janie, are there other pads available that for example, someone with fecal incontinence can have that is specially padded around the anus area of a pad?
There are a few pads that are designed for fecal incontinence. They're often a longer pad that you would sort of position more towards the back. But generally, when it comes to continence pads, the ones that are considered probably typically for urine incontinence, you can use for fecal incontinence. Obviously, if there's any soiling, you need to change it quite quickly, and you can't leave it. If there's some soiling on it, you need to remove it and put a new pad on. But as sort of Greg says, often you position it slightly differently. You position it further to the back. Yes. Having sort of firm underwear is important. Boxes can be a little bit difficult unless they're the stretchy boxes that young men sort of wear, but the cotton boxes
too. In some of them have
so you want something that sort of is firmer underwear. Even for a lady, if you've got saggy baggy underpants, it's not ideal. You want a nice good fitting pair of underpants, and maybe you need to buy yourself some better fitting underpants to hold your pad well up in place, because if it's sort of hanging lower and not right up against the body, it can leak.
Okay, that's good. Thanks.
And the other thing too is you have to really get the right fit, because you're forever having to adjust. And because of the placement where it is, a lot of the pads sort of like it gets thinner because it moulds into your bottom.
Yes.
So there's that extra part as well. So it really is whatever suits you, but to get to the right comfort level takes a little bit.
I think too, one of the things I suggest to people is try samples, especially when it comes to disposable pads. You can get pad samples, and it's often good to try a variety of pads. They're cut quite differently, they're shaped quite differently. So even when it comes to like a pull-up is all very different. So some are more high cut, some are, just different shaped waistbands, that type of thing. So it's really important that you try more than one product just to try and find which is the one that suits your body shape correctly. And as you say, when you move, when you're active, which one doesn't adjust to you without curling up too much, isn't too bit wide between the legs. So there's so much to take in when you try a product that it's really important that you try a few and try and figure out what's the right one for you.
Yeah, like for me personally, like I grew up not using pads.
Yep.
I was just using folded toilet paper.
Yeah.
Right, and that, because you can then dispose of it a lot easier.
Yep.
But that then causes a lot of irritation with skincare, and that's where the pads are so much more suited.
Yes.
But in some circumstances, sort of like if you haven't got anywhere to dispose, you're in a catch-22.
Yeah, yeah.
Not having a clinical background, you would have to be fairly confident that the fecal matter was fairly solid. If you were having loose bowel motions, that would add a whole other spectre to the selection, surely. So do you have a different ranges, or for you, do you just sort of know that your bowel motion is normally a typical type, that the toilet paper or the one continence product is going to do the job?
Yeah, because incontinence can be so unpredictable.
Yes.
And you don't know. For me personally, I stick to the same line that I'm used to, but you're always on alert to know that something's not right here.
Yeah.
So but each to their own, but I'm used to a certain one.
Yeah. And it works.
And it works for me.
Yeah.
Important.
That doesn't mean to say that you mightn't have an accident if you're out and about and then it all goes to haywire.
Yeah.
And that's what we're hoping to avoid with tonight's presentation. Janie, I've had a question in from Steve, and he wants to know whereabouts can you go to find those samples?
So a lot of the companies themselves will provide you with samples. So if you know the brand that you're particularly wanting to look at, you can even do a Google search and look at the company and call the company, or even online request a sample. Often Continence Services will provide some samples if they've got supplies, and also some of the bigger supplier companies will provide samples as well. Okay. So I really recommend people look at some samples, because they can be quite a big investment when it comes to buying even a pack of pads. Some of them can be quite pricey, and then you've got this pack that doesn't suit you. So if you can get some samples through the various companies, and again, calling the helpline, we often give you a bit of direction as to which samples it might be worth trying. So most companies happily give you of the disposable pad samples.
That's great. Thanks, Janie. I hope that's helped Steve.
Sorry, there's one more pad that I didn't mention, is also a booster pad. So a lot of people layer pads, and unfortunately when you layer a pad, so this pad, for example, does have I might actually use this example. So this pad does have a waterproof backing on it. So if I put it on top of this pad, so I layer a pad upon a pad, that means that this pad needs to be totally soaked before it goes to the next pad, and that means it'll probably spill out over the edges. So where most of the super absorbent polymers is actually in the middle or in the crutch area. So basically you're blocking the activity of the bigger pad by putting another pad on top. But if you use a booster, that's a pad that doesn't have the waterproof backing on the back. So it's designed to basically, when it's full, to leak through onto the main or the bigger pad. So it's a better option if you do feel like you need extra absorbency, rather than going to a bigger size pad or a different type of pad. You're happy with the main pad, but you want that little boost. It's possibly also consider a booster pad. They're also around as well.
That's great. Just before we continue on, I've had a comment from Donna. She said she's found male guards and shields turned around and placed at the back work well for light leakage, and she's received lots of good feedback around that as a way to do it too.
Yes, so you can imagine that if you're using it for some bowel incontinence, it's probably well shaped for bowel problems as well. Even like we call it a cricket what do you call it, cricket
Box.
shape. So you can see it can possibly have some benefits for fecal incontinence as well. But generally, most pads for urinary we would also use for fecal incontinence.
Okay. Someone's just come through, Erica, asking about charcoal pads for fecal incontinence.
I think there are some in the market. There isn't a lot, but I knew there used to be some in the market. I'm not quite up to date exactly the name of them.
And is the purpose of the charcoal
to help with odour?
Okay, lovely.
Yeah.
Sorry, we can't help you with more on that one, Erica.
Sorry, got distracted, sorry. And then we also have reusable pads and pants. So they can be used more than once, and they do look more like normal underwear, but they're generally suited to a lighter loss and probably more for urinary incontinence than fecal incontinence, because obviously cleaning faeces off washable products isn't the most pleasant and can be quite a challenging thing to do. So, for example, this is a pair of continence pants, and it actually has a built-in pad into it. So you can see for someone, it's for a lighter loss, but it looks quite like a normal pair of underwear, and it can be quite pleasant or, quite accepting to wear, particularly if you're not keen on continence pads. They can get bigger and even more absorbent. You can see there's a pad through the centre of this as well. Some of the pads come up a lot higher than this, but you won't get the absorbency of a washable pad, but you might find that, again, someone with a memory problem, they might happily wear something like this, or someone who's not too keen on wearing a disposable pad or is concerned about disposing or the amount of rubbish that's been created through the disposable pads, this might be something more acceptable. Also, put it on, it hits the right spot again. They can be quite acceptable to wear. So you're probably looking more at a range of, say, again, 50 mils to maybe 400. Some really super absorbent ones might get it to 800 mils, but nowhere near the absorbency of the disposables.
And I know we're doing a little bit more on funding a little later in this session, but is there a cost benefit for going for a reusable as opposed to a disposable?
Well, it's really hard to say, because even though you might be paying, say, $30 a pair, and obviously it lasts a lot longer. So potentially it might be a saving, but there's more work involved and there's less absorbency. So it probably depends on your continence issue as to whether it's beneficial. But say if you've got quite a heavy loss, it might not be the product for you. But if you're on a lighter end of the scale, it might be quite economical to look at something like this.
Okay, thank you.
One thing that I've noticed these days too is there's a lot of continence products for kids.
Yes.
Which back in my day would never be known. So, and that helps. That gives the kids a confidence when they go to school and even playing sport. So there are options available for children now, which are very important.
And I would expect that you already know that you're a little bit different. Yes. That having that reinforced by not having products that are around that are suitable would just continue to reinforce that. So this is a part of that destigmatising, the ability to actually have good quality of life and live a normal, for want of a better term, life while trying to manage incontinence. That becomes really important.
Yeah, it is. And unfortunately, kids can be cruel. And most of us, in our community, in the IA community, we were the smelly kid at school because, that's just, you might have an accident and not having that right protection, it really affects.
Of course.
So having these options.
Because you always remember the child who wet themselves at school.
Yes, correct.
For all the rest of their life, they're always remembered as that child, and it was probably a once occasion. So if it's something that's a risk all the time, so
that's why it's very important that the kids are getting looked after now too, from that perspective.
You probably can see on the screen too, there is a swimming pair of shorts as well. So there is some washable swimming products around as well for incontinence as well. The other thing is to also, when it comes to the washable products, when it comes to laundering, you can put them in normal domestic washing machines. Probably not use a dryer though, because some of the materials, the waterproof barriers might deteriorate. So it's better just to either wash it in normal wash or hand wash them and just dry them on the clothesline as opposed to using a dryer. No fabric softeners either, just normal washing powder should be preferred.
Okay, thank you.
All right, keep moving. There's also lots of bed protection around as well, and chair protection. So a lot of the things can either be disposable or reusable. Some of them are designed that you sit directly on them, but I do find a lot of people just use it as a backup instead. But say when someone travels, it can be quite handy to take some sort of bed protection with them, especially disposable options. So if they're a bit worried about having an accident when they're staying in a hotel or staying in a family member's home, it can be quite useful. This, for example, is a washable version. Obviously, it's much smaller than what it normally would be. It's usually about 1 metre by 1 metre. It's got a waterproof non-slip backing on the back and then absorbent top. And a chair pad version is maybe a 50 centimetres by 50 centimetres. And a lot of people I've often seen have towels on the chair or on the bed. Towels slip. Towels don't absorb as well. Towels don't have waterproof backing, and towels often are quite obvious that something's happening to that person. Well, a lot of these come in a variety of colours when it comes to the chair pads, so they can be a lot more discreet than when you've got that on someone's chair. It might not be obvious to everyone that it's actually a Continence product that you're using, and you're able to protect the furniture, or you might put it on the car seat, for example. So they can be really quite handy to have either as a backup product or as your main Continence product, where you actually sleep directly on it with nothing below your waist. And as I said, they're often handy for travel too, particularly the disposable versions of these.
Actually, just one in regard to that.
Yep.
I've just been away for the weekend.
Yep.
And even I stayed in a hotel.
Yep.
And I put a towel down on the sheet to sleep. Just because the mentality is you might soil or whatever, and just that, someone's going to come in tomorrow, they change the sheets and all that. So the stuff like that is important just for the psyche as well. Because you're automatically, you're on alert.
And I think the difference between a towel chunks up and rolls around the bed. Well, this is designed to sort of sit on the bed and not move. So it sort of gives you that added bonus that you're not sort of worried in the morning going, where is the towel gone? Oh my God, has it done what it's supposed to do? Well, when it comes to a bed pad, it should actually stay put and actually do its job. So that's one good thing about, looking at something like this. And even if you look at the chair pad option, even though it's a 50 by 50, it can be something that can be quite easy to pack to travel with as well, even if you can just put it, where you're lying if you don't move a lot in bed.
That's a good idea. Have you thought about taking something?
To be honest, it's the first time I've seen them.
There you go.
I'll be looking at that,
Yeah,
definitely.
I think that's a really great idea. It's something that you can pack and take away with you.
Yeah, and some of them, obviously, the bigger, the bed pad ones, some of them have wings, so you can tuck it around a bed. You can get double bed size ones or bigger size ones than a single bed. If you're sharing a bed, you can have the single one, and if the other person doesn't need one. So they're quite handy in that you can array it on the bed to suit what your needs are. And as I said, even the chair pads are quite handy too, even in cars, that type of thing.
These would be available from more specialised Continence product suppliers.
Yes, that's right. Yep. And then when it comes to bed protection, there's also a lot of variety when it comes to those types of things. So they're often generally reusable and washable. So, for example, if you imagine that is a mattress protector, so that's a waterproof protector on the top. It does have some absorption as well, and it's like a fitted sheet option. That's just a tiny weeny sample. There's doona protectors, so you can encase a whole doona in a special waterproof fabric that often isn't too plasticky. So the manufacturers have really come a long way in making these products a lot more breathable, and you don't feel like you're in a like the old days when you had a big plastic sheet on your bed and it was like, sauna and you got really sweaty and all that sort of stuff. There's pillow protectors as well. So they do last a decent amount of time, and they are reusable, and they are, again, not that obvious as well. So if you've got a doona protector, and then maybe put your normal doona over it, at least you're saving your doona itself, and you don't have to wash that all the time, because it's really annoying if your doona gets wet. But if you've got the protector over it, and if you've got a protector over your mattress, and you might use a protector with a bed pad as well, because the bed pad sits on top of the sheet.
Okay.
So the mattress protector encases the actual mattress itself. Then you put your sheet down, and then you put your bed pad on top of that, and you sleep directly on the bed pad. So you've got that extra layer of protection.
Okay.
But yeah, it just covers the edges of the bed and all that type of stuff, and can keep things a lot nicer for your bed. Urinary sheaths, or condom drainage, as I probably normally call them, are a product particularly for men. So I'm sure most people are aware of what a condom is. So these are adhesive condoms that you actually attach over the penis or roll on over the penis, and they stay in place for about 24 hours. They have an outlet at the end, and you can connect a drainage bag to that. So they're not suited to everyone, but for some men particularly, because they don't necessarily like wearing a pad or they don't want the pad sitting right at the back, condom drainage can be a good alternative. And there's quite a big array of condom drainages around. You need to be sized for a condom because penises vary in size and also vary in length. So there is different size circumferences or widths of condoms and also different size lengths of condoms. There is a bit of an art to using condom drainage, so it is often important to have either a continence specialist or experienced nurse to be involved in trying or sampling condoms, finding the right one for you. Some are more adhesive than others, so it's really good that you maybe, if you want to look at condom drainage, you get some samples again, because the companies will supply often a week's worth of condoms or at least a few days worth of condoms to try, plus drainage bags, so you can have a leg bag during the day and then a larger night bag overnight. And as I said, after 24 hours, you'd remove it, clean the penis, and then put a new condom on. As I said, it does take a little bit of work and education to get the right condom for you, but they can be actually really quite good. They can manage quite a large volume of urine as well. And some men really, really like using a condom as an option.
Okay, and with the leg bag, during the day, what sort of volumes are we talking about?
So leg bags often arrange for, say, 500 mils to 800 mils, but you'd need to empty it about, every, say, 3 or so hours, or when it's about, say, 2/3 full. You don't want it to be completely full because it starts to drag too much, so you need to be able to manage to empty that. But say, for example, a man who's in a wheelchair, that might mean that he can go out for the day he's got a condom on because it can drain out, and say if he can open the taps, because a lot of the bags do have taps that say if you've got limited hand function, you can still open the tap and drain it. Or you might find if you've got quite a large capacity bag, say, 800 mils, you can get out all day and not need to empty it at all in that time if it's well supported. Yeah, so they can be quite useful and a good option to consider if that's something you'd be interested in. But again, need someone to support you with it. Make sure you have the right size condom, not too small, not too big, a measured penis. We often do a bit of trimming of pubic hair, thorough cleaning, thorough drying, all that sort of stuff when we use condoms.
Okay.
Catheters are something that is around, but generally only used if absolutely necessary and prescribed by a doctor or specialist. So it's mainly used for someone who can't empty their bladder at all or not very well. It can be used, often people might have it after surgery, or some people who have a bladder that doesn't function very well might have it more long term. Catheters can either be through the abdomen, which we call suprapubic, so just above the pubic hairline. There might be a catheter that's been inserted through the tummy, or indwelling, which is through the penis or through the urethra or just above the vagina in a woman. And they drain continuously into a drainage bag, which is either a leg bag during the day or a bigger night bag overnight. Sometimes people also use a little valve on the end of the catheter, so they empty the valve directly into the toilet every sort of 3 to 4 hours, depending on how much urine they produce. We don't often use it for people who have incontinence. For example, if they rush to the toilet and can't get there in time, or they cough and sneeze and leak urine, it's generally not used for that type of incontinence. It's more used for people who have problems emptying their bladder or getting the wee out. Occasionally we might use it for someone who's got really bad skin problems, or say big pressure sores on their bottom, just to keep urine away from the skin. Or say if they're at the end of their life and in palliative care, it might be something that if it's really difficult for them to go to the toilet and they're having, again, possibly skin problems, or it's quite uncomfortable for them, we might consider a suprapubic or indwelling catheter. Intermittent catheter is when you use like a fine tube and you insert it into your bladder, say, every 4 hours or so often. So you're basically mimicking what your bladder normally does. But the catheter just goes in, you drain the bladder, and then you remove it, throw it in the bin and repeat that as required. Some people it might be every day. Some people it might be for every single week. They need to pass an intermittent catheter. When it comes to any sort of catheter, generally a nurse will be involved in teaching you how to look after your catheter. Suprapubic and indwelling catheters generally need a nurse or doctor to change that catheter. Intermittent catheters might be something you're taught to do yourself. But as I said, it's not usually something that's given out quickly and easily, because there is consequences, because anything that's inserted into the bladder has a risk of infection. There can be risk of damage to the bladder and bladder neck. So we're always very cautious about any use of catheters, but they are around.
We've got some questions coming in. Janie, can I stop you there for a moment? Have a deep breath, because you've been doing lots of talking, which is wonderful. A shout out to Brad. Thanks, Brad. I'm glad to see that you're watching us tonight. Brad's an old friend and supporter of the foundation, so that's lovely you've joined us. And in terms of the penile sheaths, he's asking, can you use them if you have a retracted penis, or do they roll up a bit?
There are shorter sheaths, so you need to have at least a little bit of penis length. So as long as you've got a little bit, a couple of centimetres, we can use a shorter sheath, or they've also got a different name like a special or something like that. So there is an option for that. There has been around some urinary collection and devices that are a bit like a stoma bag that you sort of put on over the whole area, but that's often better for someone who's not moving, who might be in bed all the time. But yeah, if you've got some retraction, it's still possible, but you want to have at least some length of penis. You don't want it that it's totally flush with the abdomen. You want to have a little bit of a couple of centimetres length.
Thanks. I hope that's helped, Brad. And another question that's just asked around the risk of pressure injuries for clients if they're using bed and chair protectors. Increase the risk of injuries if the client is high risk. So I'm not sure if they're talking about someone who is potentially immobile, or a little hard to
yeah,
know.
So I think it's not, again, it's probably not a product that I would suggest you use solo. Generally, I think you'll be using
Hopefully you've stayed with us and we've got you all on board still. So we started looking at the suggestion from one of our viewers tonight that there is a risk of pressure injuries for people using both the chair and the bed protector. Is there any evidence that supports that, Janie?
I'm not aware of any evidence, but it's not a product I generally suggest someone at high risk to sit directly on. I think generally you want to use a good continence pad, and hopefully if you've got it well contained, you shouldn't need to use those. I generally think they're a backup option. So particularly someone who's in a care setting or in a hospital, if you've got a good quality continence pad, hopefully you wouldn't need to use a bed pad or a chair pad, but I think they're quite useful, particularly in the home setting or with travel and things like that.
Lovely, thank you.
Yeah.
And I guess that's a really good opportunity to bring you in, Greg, with products that are designed to help and support, but that there is potentially a downside to them. What's your experience with that? Are there the goods and the bads in using products?
They're more of a necessity, if that makes sense.
Yes.
And one thing when you're dealing with incontinence, you have to adapt and adjust to so many different situations. If it's a matter of planning, if you're going out somewhere, or like I might want to go to the football. Well, I love going to the football. Now, ideally, you would love to be able to take extra pads and change them and all that, but the reality is the facilities aren't there. So in those situations, like I might just wear folded toilet paper. It's not ideal, as we spoke before, but at least you can dispose of them.
Yes.
So, but you just got to find what works and you deal with it.
And this is a real impact on quality of life issues, because you're a normal, everyday guy. You want to get out there and engage in all that the world has to offer. So, the product needs to be supporting you to do this. As you were talking about loving to go to the football and potentially taking the products, I just had this image of the security guys now at these venues, because all the bags get checked. And so part of the job of the foundation is that destigmatising, so that if you do have your products in a bag, that you can present it quite happily to security and not run the risk of feeling that you're being judged or that there's a snide comment coming and all of those sorts of things. So I would imagine that has a huge impact on you.
Yeah, you're sort of like, you have to be alert. Like, I know when you go on a plane, like I've had to take pads on a plane with me, and you do get a sort of like a second look to say, "You a guy? What are you doing?" Like, or even I'd have to take my cream for my skincare. And a couple of times they've said, "Oh no, you can't." Well, I said, "Well, I've got to take it. That's part of it." And so yeah, it's just you don't really. I don't take a lot of. I'm not sort of like worried about that stuff as much, because I've got to do what I've got to do, if that's the case. But but for males, we see things through a different lens, and you sort of like you have to be a bit, you're a bit conscious, if that makes sense.
Well, I guess for women, we're sort of used to having to buy sanitary products, and you learn to overcome the embarrassment of that, reasonably young in life. And often seeing men line up to purchase sanitary products is a very good cue for pharmacists or staff in places that sell incontinence products, that potentially that's a man in need of some support and help to know what product they need to buy, because sanitary napkins don't have the absorbency required for urine. They're designed specifically for menstrual blood, and so the design of them is quite different. So that's an issue, making sure that you do use continence products that are especially designed for urine and faeces. Don't go down the sanitary pad route for that.
Yeah, they're not constructed in the same way, so they don't have the same absorbency or ability to draw moisture away. And they also don't have the range of absorbencies, because you've sort of heard me talk about a 4-litre pad. Well, you won't get a 4-litre sanitary pad, that's for sure. They have much lower range of absorbencies. So yeah, I always, and unfortunately a lot of people only know sanitary pads or menstrual pads because that's all they're exposed to. So they go into the supermarket and think, oh, okay, that's my only option. But hopefully if someone hasn't seen continence products before, this opens up their eyes to the options that are available, and there's more than, having to rely upon a sanitary pad as an option.
I've had a comment that's come in. I'm not actually going to read it all out, but it raises the suggestion that what we are promoting is the use of products rather than looking at cures for incontinence. And I think it's worthwhile perhaps mentioning that we are talking about people that have incontinence, where they've gone down having appropriate continence assessments by medically trained people, and where they've tried treatment options which have either been partially successful or not successful at all, and then they do have to then live with the long-term management of their incontinence. We know that long-term incontinence is associated with high levels of depression. We know that it has an enormous impact on quality of life. So for our viewer this evening, please be assured we're not avoiding treatment options, because we know there are many out there, but we're also aware that a lot of our clients are people who cannot be cured of their incontinence, and they are entitled to a good quality of life. And that's why we are presenting topics tonight, our topic tonight, which is around looking at the products that can help with that quality of life issue.
I'd like to just mention, with my situation, with my condition, and for those in our community, we are born with incontinence. We cannot be fixed, as I say. We can have surgical treatments that assist us, but like myself, I've got no functioning sphincter muscles. I've got no nerve endings. I've got no barrier between the rectum and the anal area. So there's no permanent fix as such for me. So I've lived with incontinence from day one. So that's why I need incontinence products, and those in our community need them. we can't function socially
Mm.
without them. So there are situations where people have no choice, and I'm one of those.
And again, I think I welcome you saying that, Greg, because this is about an individual's lived experience, and it is about quality of life as well. So thank you for adding that.
No worries. And the mental health aspect is massive as well.
Yes,
because
I agree.
you're living every day with you're being alert to physically, but then you're sort of like it can be relentless. Living with incontinence can be relentless.
Yes. Thank you.
And I think it's a bit like that quality of life. Continence pads can give someone a quality of life to actually attend appointments to actively manage their incontinence. If you're too scared to leave your home, continence pad might allow you, or continence product might allow you to get out and actually attend an appointment. But if you're fearful of what could happen or an accident happening, you're never going to be able to treat or even better manage it. So, and often too, the continence journey might be you're wearing something at this point in time, but that doesn't mean that that's the pad you're going to end up with or the product you're going to end up with at the end of your continence treatment journey. So, it is an evolving thing. So, yeah, I think continence products have a definite place when it comes to continence management. And often it's just a quality of life, confidence thing to get people out and engaged in community, so that if they can get physically better, even from a health point of view, then I think continence products have a very important role to play.
We have a query around anal plugs and their value for social events. Are they suitable for anyone with fecal incontinence? Are there certain requirements if you're going to use physical requirements to be able to use an anal plug?
Yeah, so anal plugs are particularly useful if you're having sort of seepage, particularly after you've used your bowels for the day, for example. So someone who might have a particularly decreased awareness of their anus, so obviously if you're having something popped in your bottom and you're very sensitive around your bottom, it might not be the product for you. I think they're great. I think they're a great option for a lot of people who struggle with that sort of loss, and particularly like special occasions, or even I know I've had someone who would wear it for work and it made her so much more confident, and she had a neurological condition that affected her anus function. You can get samples of anal plugs too. So they're like a little tampon that when you put it in your bottom, they form a soft cup, and you can keep it in your bottom for up to 12 hours. So they definitely have a role to play. And yeah, I think it's something that if you are having some more lighter anal leakage, it might be something worth considering, particularly if you've still got some sort of function of your anus so you can hold it in place.
Okay, thank you.
Sorry.
No, you're doing a great job.
So there's also a lot of other products around that help with toileting. So say if you do have a mobility problem or a hand function problem or some sort of problem that makes it difficult for you to get to the toilet, there's other options around, such as bedpans and urinals. And I particularly love a female urinal. I know my auntie's off camping at the moment. I've given her a female urinal because she often won't be near a toilet. So she doesn't want to get out of the tent. She's now 70. Sorry, Auntie Pip. Hope you're not watching. So she can just wee in the female urinal to save her trying to get around in the dark to try and find a toilet. There's commode chairs that you can have by the bed. So if you do struggle to get to the toilet, which is a distance away, that can be quite handy. Raised toilet seats. So if you have trouble getting on and off a toilet, and frames as well over the toilet. So there's lots of different options. I do love a travel urinal too. So a lot of them just look like drink bottles, and they can be quite discreet. So and they can be concertinaed down, so you can actually make them quite small and pop them in your handbag or in your man bag, and then just pop them out when you need them. So they can be quite good for travel. And there's disposable options too. You've probably heard of young people going to concerts and they use the wee sheet, for example, so disposable urinals that they can then throw in the rubbish bin that might have the superabsorbent polymers in there that actually turn the urine into a gel, and they can be used as well. And slipper pans are just sort of smaller bed pads that sort of pop underneath a person. So it's often important to look at, if you're trying to get to the toilet and there's a challenge, is there a piece of equipment that can be adapted to help you get to the toilet more successfully, or use as a substitute for the toilet so you can actually still successfully use a toilet in that fashion.
That's great.
Okay. It's often important too, and occupational therapists might be important to involve in this point of the toileting journey. So often having an occupational therapist do a home assessment, or get some advice from an occupational therapist, and also a musculoskeletal physiotherapist is also important when it comes to being able to physically get up and get to the toilet, and looking at strength training and an exercise program can really be important to you to rely upon a musculoskeletal physiotherapist for that role as well.
Janie, I know that you've got some technical issues around the hygiene practices, which we can cover, but I just wanted to ask Greg for a moment. For you, with faecal incontinence, awareness around obviously the leakage, but also the odour, are there things that you do that give you greater confidence in that area?
Having the product gives me the confidence.
Okay.
You learn that when you think you need to go to the bathroom and sort yourself out, it becomes second nature as such. So for me personally, I don't, it's not front of mind as far as the odour and all that, because I think that I'm used to it now because it's all my life. I've got, but for someone who's just starting to deal with it, I can imagine it could be a massive issue. But for me, as you say, you just get into your routine and you sort it out. But yeah, I wouldn't, if I became incontinent now, it would be, I'd imagine my mentality would be totally different.
So Janie, what are some of the things that you can do to just help in that area?
Yeah, so making sure you do change your product regularly. So make sure it's not overfilled or over wet, or there's no, particularly for feces or poo, make sure you try and get that away from your skin as quickly as possible. So yeah, regular changing of continence products. And sometimes you have people who try and think they can get a couple of days out of a continence pad. Well, that's not ideal. You should be changing it more often than that. Keeping your skin clean and dry, and often maybe even having a wash with changes of continence products. And you will have more odour if continence leaks out of a product or gets on clothing, particularly urine I'm talking about, or gets on furniture, that type of thing. Once it gets in connection with the air, that the odour will start to occur. Obviously, with any faeces, you're going to be a bit more worried about odour too. There are odour neutralising sprays around. I'm not sure if you use anything particularly to manage odour, Greg?
No, I don't. But that's a lot of my situation is because I don't work anymore. I'm at home most of the time as well. I know that when I did work and in an office environment, you are alert to it. But saying that, I probably wasn't educated with these sprays and all that that stage. So it's anything that can help is an advantage.
So especially, particularly the sprays, you can spray it on furniture, bedding, directly on the area where the odour might be coming from. So it helps neutralise it rather than put a perfume over it. Because, often when you perfume something, you just think of that smell is now associated with the continence issue. So they're actually designed to get rid of the smell as opposed to cover over the smell. So they're quite useful. I think this is the area where I really would like Greg's input into, as in, which product is the best one. And there's no simple answer, as you can see from the list of options up there. But, one that works well, is comfortable, gives you a normal life, doesn't leak, is affordable, easy to use. No one can tell you wearing it, because there's nothing worse than a big bulgy lump coming out the bottom, or a crunchy sounding pad as you walk. And you don't want to change it too often. So you will need to change it at least every 24 hours. But I sort of say no more than, say, 4 pads in 24 hours is what you're aiming for at the maximum, because if you're changing it more often than that, it's going to be quite expensive, and maybe that's not quite the right product. I know some people do choose to change theirs more often because they don't want any moisture on it at all. But generally, you're hoping for less than 4 pads. No more than 4 pads a day. Obviously, you want to be confident that if you do have a leak, it's going to keep it all in there. I know I have a father who has incontinence issues, and he's got Parkinson's disease and has to rush to the toilet. And it's not great if he leaks. He's a man. He doesn't always wear his pad. My mother has to nag him, and especially if he's at the bowels of putting petrol in the car. The noise of the water rushing can make him need to go to the toilet more. And having a leak cannot be great. And she's the one that often ends up carrying the pad rather than him in her bag, because he doesn't have a bag. So, it's sort of trying to balance out how to lead a normal life but be comfortable and make sure it works. And, there's lots of factors that you have to put into the scenario. I know I've got more to add to that, Greg.
I would say I'd give a tick to every one of those.
Yeah.
Because for what can help you live a normal life is the most important thing. Because the reality is living with incontinence isn't normal compared to what you might have used to. I don't know what a normal life is because I've always had incontinence. So I would tick every one of those boxes because every situation and every day can change. And you don't know whether you're going to have an accident or whatever. So the strategies and having the products, everything helps. Anything that helps is good.
Obviously, there's a lot of things to consider, such as mobility, work, and we've sort of talked about different environments, being active and playing sport, social life. But I think, Greg, I might get you to talk about your travel experience, even in the last couple of days, and how you manage travel.
Yes, well, I'd just been up to northern Queensland, and I was due to come back on two flights. One of the flights got delayed for 2 or 3 hours, and then on the second flight, because it was delayed, my bowels and my incontinence started to play up. So I was sort of like stuck on the plane thinking, what's going to happen here? And because I'd planned beforehand to think, I'm only going to be a certain time on the plane and all that. So travel is a massive issue because it gives you questions. And it puts doubts in your mind. So, and it's all about planning. So, traveling with incontinence is not pleasant.
I think the planning thing is, I think that's the word.
Essential.
Yes, very much so. And always get a seat near the toilet.
Also be aware that when it comes to often the drops on packaging, each company has their own system for determining that, and their own system to work out capacity and absorbency of continence pads. So if one brand has a 6-dot option and the other one has an 8-dot option, it doesn't mean they match. There's no standard for it. So I'd still suggest, again, trying samples and trying to work out exactly what suits you. Don't say, I'm using a 6-drop in that brand, so I'm going to use the 6-drop in the other brand, because they might not be matching scales of absorbency. So it's better off to, again, try some samples and see what you can find out. So costs are expensive. Especially if you have to pay for themselves. And then if you've got permanent or severe incontinence, there is some funding options around. So I'm just going to try and get to the bit. And hopefully some of you have heard of the Continence AIDS Payment Scheme, which is a Commonwealth funded scheme. So particularly if you've got a neurological condition or you're on a disability support pension or an aged pension, you might be eligible for this particular scheme. Most states and territories also have some continence product schemes as well. The National Disability Insurance Scheme, or NDIS, if you're a participant and you do have continence issues, you should try and see if you can have your continence issues addressed within your plan. And the Department of Veteran Affairs, if you're on a gold card, you're probably eligible for continence products. And possibly if you're on a white card and you've got certain, depending on what your condition you're eligible for, you might also be eligible for continence products, and it might be worth investigating. Sorry, that was very rushed.
No, it was good.
Most disposable products you can just throw into normal household rubbish. Supposedly there are some compostable options for commercial composting facilities, but I've never heard of one or used one. Mainly don't flush anything down the toilet. Even flushable wipes often can block up your toilet. So we generally say throw it in the rubbish bin. And as I mentioned before, when it comes to washable products, use a normal washing machine, normal washing detergent, and hang out to dry. Avoid fabric softeners, bleachers and dryers if you can. And I'm going to give Greg this one.
Yes.
This is my time to shine. The Bins for Blokes campaign is a wonderful initiative organised by the Continence Foundation of Australia. And what the aim is to have continence sanitary bins in public toilets, because it's, for someone like myself, it's really difficult when you go out and you haven't got that comfort of knowing that you can change a pad, etc. So this is a wonderful initiative that's been undertaken, and hopefully this year there'll be more councils and shopping centres or stadiums, whatever, that get these bins put in, because it will definitely make a difference to the men to be able to leave the house and have that facility available. So, it's a wonderful initiative.
Thank you. And look for that little bins for blokes sign that will indicate public toilets that do have those bins provided. And the take-up is really starting to grow. So it's wonderful.
It's much needed.
Yes.
So when it comes to buying continence products, you can obviously see them in supermarkets and pharmacies. There are supplier companies around as well, and also medical supply suppliers, or individual companies plus medical supplier companies. I'd suggest you call the National Continence Helpline if you want some direction on where to get continence pads from, or continence products, I should say, from, and also if you want to get advice on continence products as well. We're available Monday to Friday, 8 till 8. And we're staffed by a nurse continence specialist. So hopefully someone could be available to answer any questions you have with regard to continence products and continence issues in general, bladder and bowel problems. Sorry, I know we're getting low on time. Obviously, it's always a good idea to see your GP, or if you've got a specialist in the area of continence issues like bladder and bowel, so urologist, gastroenterologist, colorectal surgeon. There's continence specialists such as myself available throughout Australia, and also pelvic floor physiotherapists throughout Australia. And the pharmacist can also be a useful source of information when it comes to continence products as well. Sorry, I'm just trying to zip through, and I'll leave that to you.
Lovely, thank you. So as part of the National Public Toilet Map, which is available via toiletmap.gov.au, we have the Great Dunny Hunt, which is now on. If you find toilets in regional areas, you can add them to the National Toilet Map, and you might be in the draw for a $500 FPOS voucher. So this is a chance for you to go out, find those toilets that are clean, well supported, potentially with bins for blokes, and please do add them to the Australian Public Toilet Map. It's a great initiative, certainly helps with travel. You can plan your journey from toilet destination to toilet destination, which for some people is a real critical factor when planning a road trip. So please get on board with the Great Dunny Hunt. Finally, a big thank you to you all for joining us tonight. We did get a lot of questions, and I know we didn't have a chance to get to all of them. What we will do is we will place all of these questions with Janie and Greg, and we will provide responses to you through our website at continence.org.au, and you will be able to also access the resources page. There are a variety of continence products booklets available for men, for prostate and dealing with incontinence. There is advice on continence aid payment schemes, and these are all downloadable via the resources, or again, as Janie pointed out, you can speak to one of our continence nurse specialists on 1-800-333-0066. Finally, a reminder that there are 2 more consumer webinars coming up on the 18th of May, which looks at a very important topic, which is around incontinence and intimacy. And on the 22nd of June, looking at men and their pelvic floor. Yes, gentlemen, you do have a pelvic floor, and we will teach you how to use it. On behalf of the Continence Foundation, I would like to thank Janie for your time and contribution. A very special thank you to Greg for sharing his personal journey, which I'm sure was of assistance. And we look forward to seeing you next time. Have a good night. Thanks, everyone. Bye.